Friends, ladies and gentlemen, good morning and good afternoon. Welcome to today's Smart Medical webinar, Digital Health Solutions. I'm Louise Wang of Taitra, the MC of this event. This webinar is jointly presented by Taitra, Taiwan's foremost trade promotion organization, and the Bureau of Foreign Trade, an administrative agency of Taiwan's trade policies and trade relations. Today, I have the privilege of hosting 5 leading brands in the medical tech industry in Taiwan. And these strategic and visionary leaders, namely Leotech, Wincom, Acer Healthcare, MIIS, and Apollo Medical Optics, will showcase some of their most innovative digital health solutions to the world. But before that, I would like to introduce Dr. Youzhuan Jack Lee. He is a distinguished professor in the Graduate Institute of Biomedical Informatics in Taipei Medical University. Jack is also a dermatologist in Taipei Municipal Wanfang Hospital and an elected president in the International Medical Informatics Association. He is here today to give us some opening remarks. So without further ado, let's welcome Professor Jack Lee.
Hello, my name is Youzhuan Jack Lee. I'm a dermatologist and a professor in biomedical informatics from Taipei Medical University. I'm also the president-elect of the International Medical Informatics Association, which is the largest official international society for healthcare IT applications. Today, I'm very happy to introduce to you Taiwan Excellence Awards in 2021. Among this year's awardees, there are 5 companies that are going to give us webinars to introduce their products. There are 4 of them are hardware companies. They have products ranging from handheld Wi-Fi sonogram to tiny cameras to a integrated computer platform and a non-invasive skin imaging device based on optic coherence tomography. The one software company is about AI in imaging diagnosis, focusing on diabetic retinopathy. So as you can see, Taiwan is not only famous for its semiconductor industry and chip manufacturing, we also have a very unique healthcare system that's based on a payment system called National Health Insurance System. Taiwan has been one of the best managed society against COVID-19. We have one of the lowest mortality rate and one of the lowest infection rate. And that is partially based on the digital health development in Taiwan, that we have all the electronic health record that's interlinking all the hospitals and clinics, and also linked directly with the CDC, the Center for Disease Control. And the CDC has actually a real-time monitoring of all the contacts and all the people who's in quarantine that's linked to all the electronic health record across 450 hospitals in Taiwan. So it is quite clear that the benefit of having a fully digitalized healthcare system that can really help the government fight the pandemic like COVID-19. Along with the technology and the development of semiconductor and chips, Taiwan has become one of the places that can produce the most cost-efficient and high-quality healthcare devices and software for the future of healthcare, where we do need a lot of telemedicine and AI in order to handle the future of human health needs. So we do have a very unique and extraordinary healthcare data infrastructure. By utilizing the big data, Taiwan has become one of the leading countries in AI for healthcare. Where can you find a better big data set in healthcare than Taiwan? You cannot. That's why we are continuously producing excellent healthcare product based on high technology and AI. And this is the go-to place where you find the most advanced healthcare innovations. Come to Taiwan and you will find what you need and what you want. Thank you.
Thank you very much, Professor Lee, for your kind words. Now, we are moving on to the presentations. During the session, please feel free to submit your questions by scanning the QR code on the screen or check the details of this webinar. We will collect all questions and invite the speakers to answer them after all presentations are given. And now, we are pleased to have Ms. Connie Ji from Leotech Inc., one of the first-time winners of Taiwan Excellence Awards, to introduce the latest biotechnological product, the Sono handheld wireless ultrasound. Let us welcome Connie.
Leotech was founded in 2013 by a team of top-notch system-on-chip designer and engineer. We have devoted ourselves in research and design to make the handheld ultrasound smaller, more accessible, and the most important, to bring the best quality that truly meets clinical needs. The Sono LU700 series is the first Taiwan designed and manufactured ultra-portable ultrasound. With the honor of Taiwan Excellence, we aim to make the ultrasound imaging to be used anytime and anywhere without boundary, just like the stethoscope accompanied with the doctors, so that everyone, everywhere around the world that can have affordable and quality medical solution. The Sono received CE mark and the United States FDA approval. It is registered and now available in the United States, Europe, Hong Kong, Vietnam, Malaysia, Philippines, North Africa, Iran, and many other areas. The Sono is lightweight and wire-free, easy to carry. Simply install the Sono app and you can use the probe with your mobile device, no matter it is iOS or Android. The Sono offers complete imaging modes that support wide range of applications. We also provide DICOM protocol that allows easy integration with your institution's information system. The Sono provides a superior battery life that allows the user to continuously scan for up to 4 hours. Best-in-class battery time under the active usage. The portability of the Sono makes diagnosis from home a reality. It is convenient to carry into communities or rural clinics, offer a timely, high-quality medical solution. Through a real-time communication sharing platform, it can be connected remotely to give suggestions on patients' diagnosis and treatment. Real-time display of data and imaging results allows the physicians to have access to real-time insights for accurate assessment at the point of care.
Thank you, Connie. Next, we will have Mr. H.Y. Cho, CEO of Wincom Corporation, which is one of Taiwan's leading manufacturers and medical and industrial computers, to share with us his insights about optimizing cost performance between the CPU computing and vision analytics efficiency. Mr. Cho, the floor is yours.
Hello everybody, let me introduce myself. My name is Cho, the CEO of Wincom, 26 years working experience in the embedded industry. I joined Wincom since 2003, was responsible for the R&D head, PM head, sales head, and now is the CEO. Our vision is to establish and develop company growth with our worldwide partners and lead Wincom to be the #1 medical AI solution company in the world. In medical service markets, there are growing demand on medical image processing all across from the clinical, diagnostic to surgery. For instance, the minimum invasive surgery, so-called endoscopy surgery, is now popular and growing rapidly, and based on our research, it is said that current computing technology has brought endoscopy to automatically robotic surgery and AI assisted surgery. The key value to bring in Vision Accelerator Core is to optimize cost and performance between the CPU computing and the vision analytics efficiency. Targeting on rising up endoscopy and AI assisted surgery solution, Wincom innovated panel PC and box PC solution for this application. High computing power, Intel 9th generation processors with independent NVIDIA GeForce GTX 1060 or RTX 2060 graphic card and the Intel Movidas Vision Accelerator card. Medical grade panel PC WMP-19K, 22K, 24K series, and medical box PC WPC 767, 767F series up to empower AI assisted surgery solution in smart healthcare industry. How to build a platform that could solve the problem precisely is what Wincom has worked out together with our valuable worldwide partners. Here comes with some user and current application cases for your understanding. End-to-brain product is innovated together by Showa University, Nagoya University, and the Siemens System, a subsidiary company from the Fujisoft, which is integrated with Wincom high image processing medical panel PC platform WMP-19K and Olympus endoscope. Endo-brain, the AI software judging colorectal cancer by image analysis technology. After learning with 60,000 medical records, the sensitivity is 96.9% and the correct data rate is 98%, as well as did by senior specialists or doctors. Endoscopic market is forecasted growing yearly, and the visualization system is the main domain to be focused. Take advantage of Wincom EMR solution WMP-24F to fulfill real-time video on demand at high computing needs. Now Wincom innovates WMP-24K powered with Coffee Lake Core I processor, high-resolution panel up to 4K, and equipped with graphic accelerator cards-ready design. It is targeting for AI assistant robotic surgery solutions. Access ECG data analytics for on-site EMR monitoring. Take advantage of Wincom EMR solution to fulfill real-time data reading for on-site analytics at high computing needs to secure the patients understand their heartbeats, blood pressure quality on time. OCT angiography, OCTA, is often the subject of scientific presentations and clinical research, and Wincom provided our technology integrate with powerful computing to support our clients on OCTA applications and launch the professional OCT solution. Through Wincom new design and technology in medical AI, panel PC, and box PC, it is successfully to enable our clients to launch the AI diagnostic OCT solution in the near future.
Wincom currently has won not only the Taiwan Excellence Award for years, but also Best Choice Golden Award at Computace Taipei in year 2015 and the year 2018. Additionally, Intel selected Wincom as the best market-ready solution partner in Asia Pacific in year 2020. We are proud to have achieved continuous significant growth. Wincom Design deserves your trust. Wincom Design, deserving of your trust.
Thank you, CEO Cho, for the presentation. Now, I would like to invite Ms. Amy Xiao, Business Development Manager of Acer Healthcare, to talk about how she and her team use AI and data analysis technology to create the AI-assisted diagnostic software for diabetic retinopathy. Sounds like a really good news for diabetic patients. Let's put our hands together for Amy.
Hello everyone, I'm Amy from Acer Healthcare. At Acer Healthcare, we strive to improve human health and well-being through artificial intelligence. Specifically, we collaborate with hospitals to identify unmet medical needs, utilize AI and big data analysis to develop intelligent medical products, and provide AI-driven solutions to improve patient care and outcome. Our very first product is called VeriCDR, and it is an AI-assisted diagnostic software for diabetic retinopathy. So, what is diabetic retinopathy? It's a complication of diabetes caused by high blood sugar levels damaging the retina. There are usually only minor or no symptoms in the beginning, but could lead to blindness if not properly managed. Fortunately, blindness is largely preventable with regular annual screening. So currently, over 400 million people worldwide have diabetes, and it is estimated that 1/3 of all patients with diabetes will eventually develop DR over the course of their lives. While annual DR screening is recommended for all diabetic patients, in reality, only less than 50% of patients get screened even in the developed world. This low screening rate is due to a number of challenges. First, there is a worldwide problem of shortages of ophthalmologists. The doctor-to-patient ratio is in the order of 1 to thousands, and this inevitably then leads to the problem of overworked ophthalmologists and ophthalmologists not being able to provide screening reports on time. In addition, DR screenings are often conducted at diabetes clinics, but diabetes specialists may not be trained to interpret retinal images. So this is where VeriCDR comes in to overcome these challenges. This AI software is to be installed on a computer connected to the fundus camera. When in action, it assists doctors to make diagnosis of DR from diabetic patients' fundus images and provides immediate results on referral recommendations. Specifically, VeriCDR takes in retinal images taken on fundus cameras, uses AI to analyze the images, and outputs a referral recommendation on whether the patient should be referred to an ophthalmologist for further care. Its accuracy of 93% is comparable to ophthalmologists, and VeriCDR has obtained both Taiwan and Thailand FDA's approvals. So let's take a look at how VeriCDR works in the clinical setting. Here, we see a healthcare professional using a color fundus camera to take an image of the retina for a diabetic patient. First, the healthcare professional will follow the usual protocol or routine to take retinal images for the patient. In this case, the healthcare professional is taking a retinal image of the patient's right eye. VeriSee DR system can be set up so that as soon as the image is taken, it will automatically analyze the image for signs of diabetic retinopathy and output a recommendation on whether the patient should be referred to an ophthalmologist for further care and treatment. Here, VeriSee DR has determined that this patient's right eye is healthy, so it outputs regular tracking as the recommendation, indicating that the patient does not need to be referred to an ophthalmologist yet, and only needs to come back for the annual DR screening next year. And in the case where VeriSee DR determines that the patient's eye has moderate or more severe levels of diabetic retinopathy, it will output referral recommended as the recommendation. We see that the simple clinical workflow can greatly assist healthcare professionals in screening diabetic patients for DR. The simple user interface will further allow healthcare professionals to communicate with patients better. A PDF format report with the retinal image and healthcare professionals' comments can also be generated with one click. The implementation of VeriSee DR into real clinical settings has already brought positive impacts to the healthcare sector. It not only improves the accuracy and speed of screening, provides early diagnosis and treatments to patients, better prevents disease progression, but most importantly, it improves the quality of patient care and achieves better patient outcomes. In sum, VeriSee DR is at the forefront of transforming the future of healthcare, providing unparalleled values to healthcare professionals, providers, payers, and patients alike. Some of our unique strengths are that we're currently offering an edge computing version of the software, so no internet is required and you don't have to worry about data security concerns. We try our best to offer customizations to seamlessly integrate our AI solution into the clinical workflow. And since the launch of our product, we have accumulated extensive hands-on clinical deployment experience, so we understand our customers' needs. Finally, we offer flexible ways to collaborate with our partners. Please do not hesitate to reach out to us and embark on a journey to revolutionize healthcare with us.
Thank you, Amy, for the informative presentation. As a kind reminder, if you have any questions for our speakers, or if you would like more information about the products we launched today, please fill out the sheets by scanning the QR code below the screen and leave your questions. We will answer them after all presentations are given. Coming up, we have our latest Taiwan Excellence Awards winner, Horus by MIIS. They are very well known for their ophthalmology devices. And Mr. Zhang of Horus here will be introducing their best solution for medical image primary care. He is sharing not only one, but 3 innovative products with us today. Let's welcome Mr. Zhang.
Hi, this is Zhang, and I'm from MedImage Integrated Solution Incorporated. And most of friends call us MIIS. The big logo behind us is a logo symboling our company. And it's designed from Egypt Horus eye. And why we design it? Because we hope every product we develop will bring health and hope to everyone in the world. That's also a symbol of Horus eye will bring hope and health to everyone. In the past 10 years, we always focus on a Horus series products design. And we are not only doing the hardware, we also doing the software. Our design concept is one control unit can attach with different lenses that will give you different medical images. So beside the hardware, we have software. This is DIB box. And you see, this is edge computing concept, which embedded DR AI inside. So after you use our founder's camera to take the images, you can put 2 devices together, then you will give you AI analyzing in 15 seconds. It's nice to share our technology with you. I hope after this session, we will have some chance to work together in the future. We are MedImage Integrated Solutions. Most of our friends and partners call us MIIS. We are 11-old company. We have around 110 employees and 3 factories in the world. We're not only doing design but also manufacturing. Basically, you can tell what we are really good at from our company's name. It's about images. Our core technology is design optical imaging system and integrate digital image processing into any platform. Our business cover OEM, ODM, also our own brand. The horoscope is our own brand. I think one of the big different part of the company in such scale like us is we have our own regulation team. We apply all the regulations by our own, such as TFDA, FDA, CE, and other registrations from the rest of the world. We are very honored to have Taiwan Excellence Award 5 years in a row, especially for our ophthalmology device, Cilian and the Founders camera. In the first 10 years, we designed horoscope device. It's handheld, lightweight, and one control unit supports different lenses, which is also our pattern. What will be our next technology? Today, I will introduce you our new technology from MINS. The micro camera module. This is one of our new technology from our next step. We use semiconductor manufacturing process to package camera, sensor, and the LED light. Automatically production line keep this product high quality, stability, and low cost. With lots of advantage, this MCM solution is mainly for disposable endoscope, and flexible design can be used in different type of endoscope. MRS is not only provide the MCM solution to our customer, we also ODM for our customer for the final products. This is one of example of MINS design for endoscope. We always keep design compact and develop the product in a short time to save the cost. If you have any ideas, please come to MINS. We will make it come true. This is another new technology for wound care solutions. This is the first device which embedded 3 different cameras in a medical PDA. We integrate 3D camera, color camera, thermal camera. Once you took the photo, you will have 3 different pictures in your file, give you the 3 different information of the record. Each image contains different data that will help a nurse to know more about the wound tissues and giving the best care to their patients. We will not only build up a very good hardware tool, but also the application and cloud-based EMR systems. With the application and those pictures data, the device will assist in calculation the size of the wound. Even with artificial intelligence, it will not only record the medical imaging, but it can do the tissue classifications. The device will become the best assistance for the wound care solutions. Finally, I would like to thank you for your time today for watching our presentation. If you have any new idea related to our technology, I will please you to contact with me. Thank you for your time today and have a great day.
Thank you, Johnson, for sharing your insight. If you have any further questions, don't forget to use the link on the screen and we will answer them after all presentations are given. And now, we are going to invite another first-time winner of Taiwan Excellence Awards, Apollo Medical Optics, and I am pleased to have their co-founder and CEO, Dr. David Ma, to give us a talk about optical coherence tomography, OCT, and share with us AMO's core technology on crystal fiber. Let's give a big hand for AMO.
Apollo Medical Optics presents ApolloVue S100, the revolutionary high-resolution in vivo OCT system. With a penetration depth of 400 micrometers, you can examine the cellular detail underneath the surface of the skin. With AMO's unique light source, our full-field OCT system can generate superior images like no other technology. Skin is the largest organ in the human body, and its health is vital for quality of life. So more and more people are paying attention to their skin. The cost in diagnosis and treatment of skin diseases and aesthetic medicine increases yearly, causing a tremendous medical burden in countries worldwide. At present, dermatologists use dermoscopy as a tool to examine skin lesions suggestive of skin cancer. Thus, there is an increasing demand for faster and more accurate diagnostic devices to improve the quality and efficiency of skin diagnosis. High-end, non-invasive imaging systems provide clinicians a new tool in skin monitoring. ApolloVue S100 image system provides real-time cellular-level resolution OCT images to assist physicians in initial diagnoses and to improve diagnostic efficiency. The integration of OCT and image guiding systems allows users to locate skin lesions. Through image registration, users can understand where the OCT relative position is on the actual skin. Precise positioning can record the exact area for future tracking. B-scans provide cross-sectional images, which can correlate with histology images. You can also adjust the scanning speed to obtain more precise images. E-scans provide en face images to examine particular features, such as melanin distribution. Users can easily switch between the B-scan and E-scan in just 1 second. Furthermore, our OCT provides C-scans, a type of continuous photography at a particular depth, which can reconstruct the 3D cell structure. A skin treatment often requires a new scan to measure the progress of treatment. Our precise positioning can record each OCT image. Hence, you can conveniently compare OCT images obtained from different patient visits. AMO values every need of doctors and patients. Our mission is to successfully develop products that will bring about the breakthrough development of Taiwan's medical devices and medical technology in the healthcare industry. AMO, your best partner for skin diagnosis. C to cure, improving healthcare and human welfare.
Hello everyone, my name is David Ma. I'm the co-founder and CEO of Apollo Medical Optics. I'm here to present our revolutionary technology and product to you. Apollo Medical Optics is a medical technology company based in Taiwan, developing optical imaging device based on the revolutionary technology known as full-field optical coherent tomography, also known as FFOCT. What is OCT? OCT is a non-invasive optical imaging technique using an interferometry method, which can differentiate the backscatter light from different layers within the sample and reconstruct the microstructure of the tissue. Therefore, OCT can provide high-resolution, real-time 2-dimensional and 3-dimensional images. AMO's core technology is crystal fiber light source. Our OCT system utilizes the crystal fiber technique with our unique broadband light source and high brightness light source. Our OCT system has the world-leading imaging quality. Here, I'm thrilled to present our ApolloVue S100 image system to you. ApolloVue S100 image system provides high-resolution, cross-sectional, en-face and 3-dimensional images, helping clinicians to obtain more efficient diagnosis. Our OCT can generate high-resolution, cross-sectional OCT images in less than 2 seconds, so you can capture real-time in vivo images. There are 2 major applications of our OCT system: skin health monitoring and aesthetic medicine. Skin is the largest organ in human body. A lot of skin-related disease happen under the surface of the skin. Currently, there is no good tool for dermatologists to see what is going on under the surface of the skin. Dermatologists must do biopsies to examine the skin condition, and it is very time and cost consuming. Nevus and melanoma may be clinically similar, and sometimes it is difficult for dermatologists to diagnose with naked eye or by dermoscopy. Our OCT system provides clinicians a non-invasive way to visualize nevus features, which can help clinicians differentiate lesion sites from normal skin. We have also demonstrated that our OCT system is very effective in differentiating large cell acanthoma. The result has been published in year 2019. For aesthetic market, there are huge aesthetic lasers market around the globe. We believe our OCT system can provide a better monitoring tool for aesthetic physicians. We also collaborate with aesthetic doctors. One doctor had used our OCT system to observe laser-induced optical breakdown, also known as LIOB. The result showed our system had a great potential in aesthetic medicine. Our first goal is to focus on the clinical development of our device for skin health, followed by the applications in ophthalmology, pathology, endoscopy, and basic research market in the future. At the same time, the combination of medical image and artificial intelligence is also our future goal. AMO will continue to advance our technology to provide the best imaging system on the earth. We believe that by giving doctors wonderful tools, you enable them to provide high-quality diagnoses. We also believe that we can bring this revolutionary technology to the world. High-resolution OCT will be very beneficial to human skin health. We are AMO, the leader of non-invasive visualization technology. For more information, please feel free to email us or visit our website. Thank you very much.
Thank you, Dr. Ma, for presenting the ApolloVue S100 image system. Now, I would like to have all 5 speakers to the Q&A session, and for those who are joining us online, I believe you have left your questions using the QR code below the screen. If you can't find it, you can also use the link we provide in the Taiwan Excellence YouTube channel profile. The first one is for Leotech, and the question is, please specify the potential target customers of this small ultrasound. And Connie, would you care to share your answer?
Thank you for your question. The use of portable ultrasound is known as point-of-care ultrasound, also called POCUS. In past years, there was an explosion of POCUS. It is widely accepted and used by doctors from different areas, such as cardiology, critical care, emergency medicine, anesthesiology, MSK, and veterinary. It provides fast, timely, critical information as decision support to doctors.
Thank you, Connie. And our next question goes to Wincom Corporation. What are the core technology and unique designs of Wincom's medical panel PC? Mr. Cho, CEO of Wincom, would you like to share your insights?
Wincom's panel PC is targeting for the operation room and so-called surgery. So that means we have some unique features in our medical panel PC. The first one is antibacterial. The second one is the battery inside. Because for some application in the mobile car, they need the battery inside. The third one is the high quality image processing. So we design a NVIDIA MXM module inside. The last one is how to optimize the CPU computing and maximize the battery life. So we designed a eye control system.
Thank you, Mr. Cho. And now a question for Acer Healthcare. Do we need very good quality of images for your AI system to analyze? Amy, would you care to share your answer?
We categorize the quality of images into 3 categories: good, fair, and bad. As long as the image is not so bad as even ophthalmologists cannot interpret, our AI system can accept and analyze images with quality levels of fair or better. Basically, as long as the image can be interpreted by ophthalmologists, our AI system can also analyze.
Thank you very much, Amy. Our next question is for Horace by MIIS. Please identify the applications and the main functions for your MPDA product. And I would like to invite Johnson of Horace to answer.
This is very good questions. The application for our MPDA 100, the WooCare device. This is 3 camera embedded in this device. And yeah, it's not only you can use on the WooCare, it also can be used in telemedicine or home cares, because it can record all the tissues situation that you can record. But also it's an Android platform. So if you design any application that which can use those 3 cameras, then we can integrate your application with our hardware. For example, it has thermometers, so it can use as a thermometer in the entrance door, such as like during the COVID-19 pandemic. Then you can record all the guests coming to your company and have a temperature meter and also record the guests.
Thank you, Johnson. And now we have a final question, and this one goes to Apollo Medical Optics. What kind of business collaboration are you looking for? CEO David Ma, would you care to share us your answer?
Thank you for your question. Our OCT system has already received US FDA approval and Taiwan FDA approval, and we will get CE mark soon. And we want to find quality distributors who already involved in the field of dermatologists, and I believe we can provide a state-of-the-art technology and product to you, and we can be a good partner.
Thank you, David. The webinar has now come to an end. Thank you all for your participation. We hope this event has helped provide you a better understanding of the new trends and innovations developed in Taiwan. If you have any further questions for our speakers, please feel free to fill out the sheet by using the link in our channel's profile details. In the next few weeks, we are going to hold more online conferences like this, and you are more than welcome to join with us again. Have a wonderful day, and we will see you soon.
In the face of a worldwide pandemic, Taiwan has actively lent a helping hand to the world. Taiwan Global Anti-COVID-19 Pavilion. In this website, we've created an anti-epidemic products and solution providers section, where you can find information about suppliers or any particular business solutions. This section will help you reach out to more than 2,000 Taiwanese companies who can aid in your fight against the pandemic. In these videos, companies and experts discuss the latest innovations to help combat the pandemic. In this section, we've put at your disposal the contact information of 20 Taiwanese top medical institutions. We also inform you about the main strategies used in Taiwan to effectively control and stop the spread of the virus. So please be sure to bookmark and share this website. And remember to follow us on Facebook for our latest updates.